Good day. My name is Minnie Grey. I am the Executive Director of the Nunavik Regional Board of Health and Social Services. I grew up in a small community practicing traditional activities, and then, as was the practice of the government in those days, I was sent away to Ottawa at the age of 14. This experience, leaving my family and traditions, was not easy, but I believe it has encouraged me to know the best of both worlds. I've been involved in the health sector for 30 years, as well as having various elected positions in local, regional, and international organizations. In order to understand the policies and practices that are being put into place in our region, it is important to understand who we are and a bit of our history. Inuit originated in the Arctic of the circumpolar regions. In my region called Nunavik, Inuit make up 90% of today's population. The other 10% consist of people coming to the region to work with us, and some have stayed to bring up their own children. Today, the region of Nunavik consists of 14 communities with populations between a couple of hundred to a couple of thousands. The communities are not accessible by road. We travel by plane and at times by boat and skidoo to see family in other communities. But traditionally, we lived in smaller units before the communities were developed. My ancestors, my own mother and grandmother, lived on the land as nomads, surviving off the land, living in igloos in the winter and tents in warmer seasons, traveling by dog team, kayak, and even by foot. This was as early as 60 years ago. Our people have experienced rapid social change in such a short time, from those days to the technology that we live with today. Some of these changes included being removed from our way of life, from our families, to attend schools, the introduction to infectious diseases such as tuberculosis that forced people to live far from their homes in sanitariums for treatment. This was the start of the unraveling of our strong social structures. Despite all that, we have survived, being adaptable and resilient. We maintained our language, our way of life, to enjoy our traditions, our clothing, our food, living off the land. Our youth are comfortable in the two worlds, speaking three languages, English and French being the second and third languages. But we are still in a situation where youth are not able to continue their higher education in our own communities, so they have to be sent away still to major cities to continue their education, which is a major challenge for many. Regarding the health and social services in our region, the federal government was in charge of dispensing health care, but with no permanent structures in our small communities in the older days. A doctor would fly in occasionally, or the Hudson's Bay manager was in charge. In 1975, Inuit of Nunavik negotiated the James Bay and Northern Quebec Agreement in response to the major hydroelectric dam that was being built in James Bay. We were the first Inuit to ever sign a land claims agreement. The James Bay and Northern Quebec Agreement was then implemented to create the various institutions that we now administer under the Quebec legislation. Within our own sector in health and social services, we have an all-Inuit board, but many of our professionals are non-Inuit, mainly because of these issues related to obtaining higher education and the policies that make it impossible to do clinical work without being part of a professional order. Policies also influence salary and benefit disparities between professionals and Inuit working in the system, but who don't have those clinical titles. We have issues such as high turnover of clinical staff, many not being trained enough to understand our realities, families not feeling 100% comfortable with the type of services that are offered within the regular institutional services, which are not always adapted to our way of life. In many ways, there is an application of foreign laws that are not culturally relevant, which creates situations of unequal access to services for our families, not enough prevention and first-line services, too much youth protection and signaling, and constrained crisis interventions. Challenges have included the loss of our youth, and we're trying desperately to address these deaths of despair. We are doing this in our own way. We have created an annual event called the Puttauti, which is a suicide prevention and well-being program where we do reach out, safe talk, generational trauma healing, support one another, and this conference is done by Inuit for Inuit. We are doing many things to address these different challenges. We are creating our own initiatives to address the issue of policies that come from the foreign system to make services more culturally relevant and safe. I have a few examples. Sahayuk, meaning a change in the wind direction, is an initiative designed by the Nunavik organizations and is administered by the Health Board. Its purpose is to rebuild Nunavik society and its family structures through a better awareness and support programs combined with direct and rapid access to justice and health services adapted to our regional and local needs and offered in cooperation by all government, regional, and community organizations. It is intended to ensure coordination of services delivered by the Quebec Ministry of Health, Ministry of Justice and Public Security, along with our regional and community stakeholders. By clarifying the roles and responsibilities of Quebec, regional and community stakeholders, Sahayuk aims to improve the continuum of services for those in needs. The goals include improve how services are delivered during crisis situations, reinforce the input of the local justice committees in the judicial process in all levels of intervention, reduce the number of repeat criminal offenders by adapting rehabilitation to regional authorities and Inuit values, promote awareness and prevention programs to fight drug and alcohol abuse and the resulting violence and crimes, and to support intervention and services for residents at risk and in difficulty, improve the provisions of psychosocial services, addictions, mental health, troubled youth, etc., and increase the number of addiction treatment spaces in Nunavik and access to centers in southern Quebec. The main objectives of this program is to curb alcohol and drug abuse with a view to reducing physical and psychological harm they cause, as well as resulting overrepresentation of Nunavik Inuit in prison. Nunavik mi ilagit papatavinga, NIP, an integrated family service vision. In 2013, the Health Board initiated a review of the protection services provided to youth in Nunavik and how this clientele could benefit from special cultural and regional adaptations. Following this review, the Regional Advisory Committee on Youth Services was created. In 2017, this committee hired an Inuit woman as its integrated youth and family advisor with the task of setting up an intensive consultation on the application of the Youth Protection Act, YPA, in Nunavik. A group was formed with members from the elders, regional leaders, youth, women's association, and key stakeholders. The group was named Sukait, meaning the pillars. Their conclusion following the community consultation was to create the Nunavik Ilagi Papatauvinga, which would encompass all youth services and oversee the implementation of the YPA to be more culturally relevant and sensitive to the Inuit way of life. We are presently working on an agreement with the Quebec government to use Section 37.5 of the YPA, which allows Aboriginal communities to take on the responsibility of offering services that fit into their realities. This would then allow Nunavik to create a system better suited to our communities, the families, and the youth. Far too many Inuit children become separated from their families, communities, and many end up in the youth court system. This new initiative by Inuit for Inuit is intended to keep families together by giving them proper and culturally sound support. These are only two examples of how we want to see our culture integrated into these foreign services, which are not always adapted to our realities. Other programs we're working on include the Nunami on the Land program, which promotes well-being on the land. Our traditional activities on the land are very therapeutic and good for our mental health. Nunavik family houses designed with the community in mind and respectful of our culture and our language, fostering child development and supporting parents by providing them tools that will contribute to this development. Putautit Suicide Prevention and Healing Conference was initiated some years ago, and we have designed a model for presentation and promotion activities based on the experience of this conference, giving more opportunities for smaller communities to receive more sustained attention for grieving and healing activities. All these initiatives created by Inuit for Inuit have our culture, language, and traditions as foundations for providing services that are more sensitive and understanding of our way of life and all that is part of us. Our ancestors survived on the land despite harsh environments. So as modern Inuit, we want to take their strength, their resilience, and their adaptability to ensure our well-being and to give a brighter future to the next generation. Thank you. Merci.